Your heart is a powerful muscle that pumps life-sustaining blood throughout your body. But did you know that it's also susceptible to a silent yet potentially deadly threat known as infective endocarditis? As we delve into this condition, we hope to shed light on its causes, symptoms, and treatment options, empowering you with knowledge that could prove vital not only for yourself, but also for those you care about. So, let's take a deep dive into understanding infective endocarditis. Most people think of heart disease as clogged arteries or weak valves, but there's another hidden danger: infective endocarditis. This silent and deadly infection attacks the inner lining of your heart and valves. If missed, it can be fatal. But what exactly is it, and how do you recognize the warning signs before it's too late? Stay tuned. In this video, we will be covering the following topics. So, if there's any topic that you are particularly interested in, make sure to skip ahead using the timestamps below. What is infective endocarditis? Infective endocarditis is a rare but potentially life-threatening infection of the inner lining of your heart, known as the endocardium. It typically affects the heart valves, causing them to become inflamed and may lead to the formation of blood clots. The primary culprits behind this condition are bacteria or fungi that find their way into your blood. However, the infection doesn't necessarily stay in the bloodstream. Instead, these microorganisms have the ability to attach to already damaged heart valves or abnormal heart tissue, such as that found in individuals with congenital heart defects. Over time, they multiply and form layers of fibrin, platelets, and immune cells, creating dangerous clumps referred to as vegetations. These growths can obstruct blood flow, impair the proper functioning of the heart valves, or, in severe cases, break off and travel through the bloodstream to other parts of the body, such as the brain or lungs, causing further complications. His heart risk. While infective endocarditis can affect anyone, certain individuals are at a higher risk of developing this condition. People with pre-existing heart conditions such as damaged or replaced heart valves, congenital heart defects, pacemakers, or a history of rheumatic fever are particularly vulnerable. Additionally, intravenous drug users and those who have undergone recent dental procedures, surgeries, or catheterization are at increased risk due to the introduction of bacteria into the bloodstream during these activities. Before we move on, please take a moment to subscribe to the channel. If you find our videos helpful, please support us. Symptoms you can't ignore. Recognizing the symptoms of infective endocarditis is crucial for early diagnosis and treatment. However, it's important to note that these symptoms can vary widely and may mimic other conditions, making it challenging to identify the infection. Early signs and symptoms of infective endocarditis may resemble those of the flu, including fever, chills, and fatigue. Other common symptoms include night sweats, malaise, and weight loss. Additionally, tiny red spots on the skin known as petechia may indicate bleeding under the skin caused by bacteria. Some individuals may also experience painful nodules on their fingers or toes, which are characteristic of Osler nodes. Furthermore, the infection can cause inflammation of the heart muscle, leading to symptoms such as shortness of breath, chest pain, or palpitations. In severe cases, infective endocarditis can result in stroke-like symptoms due to the presence of blood clots or emboli in the bloodstream. Diagnoses and tests. Diagnosing infective endocarditis can be challenging as the symptoms often mimic other conditions. Doctors typically begin by taking a detailed medical history, performing a physical examination, and conducting blood tests, including blood cultures, to identify the specific type of bacteria present. Echocardiography is a valuable tool for visualizing the heart valves and detecting any abnormalities such as vegetation. Additionally, other tests such as electrocardiogram, chest x-rays, and sometimes cardiac catheterization may be employed to assess the extent of the infection and any associated complications. Treatment. Treatment for infective endocarditis typically involves a prolonged course of intravenous antibiotics to eliminate the infection. The duration of antibiotic therapy may vary depending on the severity of the infection, but it often extends to several weeks. In some cases, the treatment may be administered in a hospital setting, while in others, it can be continued at home. To ensure the effectiveness of the treatment, it's crucial to adhere to the prescribed regimen and complete the full course of antibiotics as directed by the healthcare provider. Surgery may be considered in cases where the infection has caused significant damage to their heart valves or other structures. The surgical procedure may involve the replacement of affected valves or the removal of infected tissue. Part 6. Following treatment, ongoing monitoring is essential to ensure the eradication of the infection and prevent its recurrence. Regular follow-ups with a healthcare professional, including periodic blood tests and echocardiography, can help assess the recovery process and identify any potential complications. Additionally, lifestyle modifications such as maintaining good oral hygiene and avoiding intravenous drug use can reduce the risk of future infections. By adhering to these measures, individuals can effectively manage their condition and minimize the risk of infective endocarditis recurring. Can you prevent infective endocarditis? While infective endocarditis can be a serious and potentially life-threatening condition, there are preventative measures you can take to lower your risk of developing it. One crucial step is to maintain excellent oral hygiene, as bacteria from the mouth can enter the bloodstream and contribute to the infection. This includes brushing your teeth twice a day, flossing regularly, and visiting your dentist for routine checkups and professional cleaning. Additionally, individuals who have pre-existing heart conditions or are at high risk for infective endocarditis may be advised to receive antibiotics before dental procedures, surgeries, or other invasive procedures that could introduce bacteria into the bloodstream. For example, if you have a history of heart valve problems, it's essential to inform your doctor before any dental work, so they can prescribe appropriate antibiotics as a precautionary measure. Furthermore, avoiding unnecessary piercings or tattoos can also reduce the risk of infection, as these procedures can introduce bacteria through the skin. By taking these preventive measures, you can significantly lower your risk of developing infective endocarditis and keep your heart protected. Conclusion. Infective endocarditis is a rare but potentially life-threatening condition that occurs when bacteria infect the inner lining of the heart. Understanding the symptoms, risk factors, and preventive measures is crucial for early detection and treatment. While it can be challenging to diagnose as the symptoms often mimic other illnesses, prompt medical attention can lead to better outcomes. Treatment typically involves a combination of antibiotics and in some cases surgery to repair or replace damaged heart valves. By maintaining good oral hygiene, avoiding unnecessary dental procedures, and practicing general safety measures, you can significantly reduce your risk of contracting this infection. We hope you found this video informative and that it has shed light on this serious yet often overlooked heart condition. If you enjoyed this video, please give it a thumbs up and share it with others who might find it useful. Don't forget to subscribe to get notified about future content. Stay healthy and take care.